Hello everyone, I'm Claire Woebke from the College of St. Scholastica presenting today on the efficacy of Pilates-based exercises in the treatment of chronic nonspecific low back pain, a critically appraised topic. I would like to thank Dr. Carrie Wolf-Odland for her collaboration and support. Low back pain is the most common musculoskeletal disorder affecting over 80% of people at some point in their lifetime. Of those suffering from low back pain, an estimated 85 to 90% have persistent symptoms without a specific pathology. Chronic nonspecific low back pain is characterized by pain or discomfort in the region between the costal margins and the inferior gluteal fold, with or without referred pain to the lower limbs, without serious spinal pathology or nerve root compromise, and lasting more than 12 weeks. Chronic nonspecific low back pain is associated with the dysfunction of the deep abdominals, pelvic floor, and multifidus, leading to decreased spinal stability and mobility with reduced postural control. Patients experiencing chronic nonspecific low back pain suffer from disability that limits their activities of daily living and creates dysfunctional movement patterns. Over time, these dysfunctions lead to physical disability, inappropriate neuromuscular adaptations, and changes in lumbar curvature that must be corrected to increase quality of life. Interventions for the management of chronic nonspecific low back pain are broad and variable, but the efficacy of traditional exercises lacks evidence of clinically relevant long-term effects. The Clinical Practice Guidelines for the Treatment of Chronic Nonspecific Low Back Pain recommend a variety of interventions, including supervised exercise therapy, cognitive behavioral therapy, educational interventions, and manual therapy. The main clinical practice challenge when attempting to treat chronic nonspecific low back pain is the large number and diversity of anatomical and physiological presentations. Exercise is highly recommended by clinicians. However, there is no general consensus on the most appropriate exercise program. Clinicians are forced to experiment with varying treatments to determine which intervention may bring healing and positive patient-reported outcomes. As modern healthcare moves toward patient-centered active management, there is a greater need for consistent physical therapies to bring about healing rather than modality use and passive treatments. The clinical question being addressed today is what are the effects of a Pilates-based therapeutic exercise plan in individuals with chronic nonspecific low back pain compared to traditional exercises? Sources of evidence were gathered from peer-reviewed articles using the search terms Pilates, nonspecific low back pain, chronic nonspecific low back pain, and exercise. Articles were included based on the presences of pathology, method of evaluation, the numeric pain rating scale and quality of life measurements, and patient population having no previous history of lumbar spine pathology. Exclusion criteria included the diagnoses of specific back injury and previous back pathology. All literary evidence was compiled from PubMed, Cochrane Library, and Sport Discus. All three included articles met 7 out of 10 items on the Physiotherapy Evidence Database scale. To understand the treatment of chronic nonspecific low back pain, the pathoanatomical influences on pain must be considered. An imbalance in the lumbopelvic complex and misalignment in the spinal column affects the deep trunk musculature. The lumbopelvic muscles are then unable to maintain the pelvis in a neutral position, leading to either anterior or posterior pelvic tilting. Pain may be responsible for the onset of deep trunk muscle dysfunction due to changes in pelvic tilting and lumbar curvature, but it can also be the result from these changes, making it difficult for clinicians to distinguish the true problem. Chronic nonspecific low back pain also presents with weakness of the transversus abdominis and multifidus, which lead to decreased spinal stability and mobility. The Pilates method has been proposed as a more effective and focused exercise approach for the treatment of chronic nonspecific low back pain. The focus of Pilates is to enhance strength, flexibility, balance, and coordination, as well as re-educate muscles through sets of controlled, precise movements. A distinct feature of the Pilates method is its focus on the coordination between the body and the mind. There are 6 principles of the Pilates method, including centering, concentration, control, precision, breath, and flow. With both physical and psychological benefits, the Pilates method addresses the underlying motor control impairments that may contribute to chronic nonspecific low back pain. Pilates is indicated because of the focus on the reactivation of the deep trunk musculature, which improves support to the lumbar spine, as well as improved postural control. The centering principle relies on the isometric contraction of the transversus abdominis and the internal oblique muscles. This isometric contraction prompts an increased antagonist co-activation of the multifidus. Therefore, the Pilates method utilizes both the active and local neural subsystems to activate global muscles in response to major forces imposed on the body. By reactivating and controlling the deep trunk musculature with associated breath control, the lumbopelvic region is stabilized and can be mobilized appropriately, which ultimately reduces pain and increases function. With chronic nonspecific low back pain having many presentations, clinicians are in need of an effective exercise-based method to base their rehabilitation plans off of. The Pilates technique provides a progressive way to stabilize the core musculature, decrease pain, and increase quality of life both in the short and long term. Re-education and proper activation of the deep trunk musculature shows positive results in treating chronic nonspecific low back pain. Overall, Pilates is an easy, cost-effective way for clinicians to place patients in an optimal healing environment while taking a global approach to their healthcare.